Sinusitis signs and symptoms include sinus headache, facial tenderness, pressure or pain in the sinuses, in the ears and teeth, fever, cloudy discolored nasal or postnasal drainage, feeling of nasal stuffiness, sore throat, cough, and occasionally facial swelling. Symptoms of a bacterial sinus infection include facial pain, pus-like nasal discharge, and symptoms that persist for longer than a week and that are not responding to over-the-counter, OTC, nasal medications. Sinus infection is generally diagnosed based on the patient history and physical examination. Bacterial sinusitis is usually treated with antibiotics. Early treatment of allergic sinusitis may prevent secondary bacterial sinus infections. Home remedies for sinusitis and sinus infections include over-the-counter, OTC, medications such as acetaminophen, Tylenol and others, decongestants, and mucolytics. Nasal irrigation can be accomplished with a neti pot or rinse kit, nasal bidet. Rare fungal infections of the sinuses, for example, zygomycosis, are medical emergencies. Complications of a sinus infection that may develop are meningitis, brain abscess, osteomyelitis, and orbital cellulitis. There are no fungal vaccines available to prevent fungal sinus infections. What are the sinuses? How many do we have? A sinus is a hollow, air-filled cavity. For the purposes of this article, a sinus will refer to those hollow cavities that are in the skull and connected to the nasal airway by a narrow hole in the bone, ostium. Normally all sinuses are open to the nasal airway through an ostium. Humans have 4 pair of these cavities, each referred to as the frontal sinus, in forehead; maxillary sinus, behind cheeks; ethmoid sinuses, between the eyes; and sphenoid sinus, deep behind the ethmoids. The 4 pair of sinuses are often described as a unit and termed the paranasal sinuses. The cells of the inner lining of each sinus are mucus-secreting cells, epithelial cells, and some cells that are part of the immune system, macrophages, lymphocytes, and eosinophils. Functions of the sinuses include humidifying and warming inspired air, insulation of surrounding structures, eyes, nerves, increasing voice resonance, and as buffers against facial trauma. The sinuses decrease the weight of the skull. If the inflammation hinders the clearance of mucus or blocks the natural ostium, the inflammation may progress into a bacterial infection. 18 signs and symptoms of sinus infection or sinusitis. Which types of doctors treat sinusitis and sinus infections? Many sinus infections can be treated by your primary care physician or an internal medicine doctor. However, it is not unusual to consult an ENT, eye, ears, nose, and throat specialist, infectious disease specialist, allergist, or immunologist. With some complex sinus infections, a surgeon who specializes in sinus surgery may be necessary to consult. What antibiotics and drugs treat and cure sinus infections and sinusitis? List. Viral sinusitis. Antibiotics are not necessary for sinusitis caused by a virus. Frequently recommended treatments include pain and fever medications, for example, acetaminophen, Tylenol. Decongestants and mucolytics disolves are medications that dissolve or break down mucus, for example, guaifenesin. Bacterial sinusitis. Bacterial infection of the sinuses is suspected when facial pain, nasal discharge resembling pus, and other symptoms last longer than a week, and are not responding to over-the-counter, OTC, nasal medications. Acute sinus bacterial infection usually is treated with antibiotics aimed at treating the most common bacteria known to cause sinus infection. It is unusual to get a reliable culture without aspirating the sinuses. The 5 most common bacteria causing sinus infections are Streptococcus pneumoniae, Haemophilus influenza, Moraxella catarrhalis, Staphylococcus aureus, Streptococcus pyogenes. Antibiotic treatment for sinus infections must be able to kill these 5 types of bacteria. Amoxicillin, Amoxil, is acceptable for uncomplicated acute sinus infections, However, many doctors prescribe amoxicillin clavulanate, Augmentin, as the first-line antibiotic to treat a possible bacterial infection of the sinuses. Amoxicillin usually is effective against most of the strains of bacteria. Penicillin allergies and treatment for sinusitis. Other antibiotics may be used as a first choice if you are allergic to penicillin, for example, cefaclor, Ceclor, Loricarbef, Lorabid, clarithromycin, Biaxin, azithromycin, Zithromax, sulfamethoxazole, Gantanol, trimethoprim, Bactrim, Septra, ciprofloxacin, Cipro. If you don't improve after 5 days of taking the antibiotic, contact your doctor because he may want to switch antibiotics to one of the 5 listed above or amoxicillin clavulanate, Augmentin. Generally, an effective antibiotic needs to be continuously for a minimum of 10 to 14 days. However, it is not unusual to treat sinus infections for 14 to 21 days. Some antibiotics now are thought to reduce inflammation, independent of the antibacterial activity. Subscribe here for more scientifically proven videos and thanks for watching.